Cancer, death, multi-million-dollar ads. Does it bring anything to mind? Does it look a lot like this? Today I'm going to talk to you a lot about smoking, and I'm going to talk to you about what it does to your health, what it does to other people around you, and maybe some solutions to even stop smoking yourself. The CDC states that 1,315 people die per day and 480,000 people die per year just from smoking cigarettes alone. That accumulates for 1/5 of the deaths that happens in America per year. It actually kills more people than HIV, gun violence, motor vehicle deaths, illegal drug use, and alcohol abuse per year just due to smoking cigarettes. It's actually 10 times more deadly than any American war that we've ever had, that US has ever been involved with. And that seems like a real big issue for me. The CDC also states that 9 out of 10 people that have lung cancer and that did die from it was involved with smoking cigarettes or secondhand smoke. And 8/10 were involved with COPD that causes death from cigarettes. And those are big numbers. If nobody smoked, they would say that 1/3 of our cancer patients would survive and would not even probably accumulate cancer at all in the first place. It also affects a bunch of other things like personal taste, like as in the health of your teeth, the health of your skin, the health of your heart. And actually, here's a few benefits of not smoking cigarettes that can happen immediately as soon as you start quitting. "20 minutes after you quit smoking, your heart rate seems to drop. They say 12 hours after smoking, carbon dioxide in your level in your blood drops back to normal. 2 weeks to 3 months after quitting, your heart risk begins to drop and your lung functions begin to improve. 1 to 9 months after quitting, your coughing and shortness of your breath decreases. 1 year after quitting, your addressed risk of coronary heart disease is half that of a smoker's. 2 to 5 years, your stroke risk is reduced that is a non-smoker. 2 to 5 years after quitting, your risk of cancer of the mouth, throat, esophagus, and bladder have halved within 5 years. 10 years after quitting, your lung cancer death rate is about half of a smoker's. Your risk of a cancer in your kidneys and in your pancreas decrease also. And after 15 years, your risk of a coronary heart disease is back to that of a non-smoker." So listen, is smoking really worth it? By not smoking, you can also do a lot of things helpful for, not only for yourself, but for your environment, for your climate, and for your family, even your own pets. They say that you shorten the life of your home pet's life expectancy by 2 years if they inhale secondhand smoke. And for children, they can incorporate respiratory disease, ear infections, and maybe even SIDS. Would you want killing a baby on your hands just from secondhand smoke? I would think not. And for adults, like with asthma, it would actually worsen that, or it could even give them bronchitis and possibly risk of their life as well. There's a lot of things that you can do to actually stop smoking. They have a lot of age groups on the CDC website also that I have listed in my sources. They have telephone calls. They have therapists that can speak to you through it. They have text message and apps that you can even set for your phone. And it'll send you helpful updates just about smoking, or maybe helpful hints, or maybe even track how much you do smoke or where you do smoke. Because smoking alone, even the secondhand smoke's 20 people or 20 feet away from where you are smoking at currently. And it can stay in a well unventilated room for hours and infect everybody that comes in that room. I would say the next time you want to smoke, maybe just give it another thought. And maybe think about the people that you might hurt just by doing these things that you've done previously.